Hello, everybody. I'd like to be the first to welcome you back to work. Coming back to OSI, I'm really looking forward to seeing everybody here. We've done a lot of things to make the office safe, and I want to talk for a few minutes about those things. You'll see when you come, we've set up the office configuration such that there's social distancing in the workspaces. We've put in a face recognition system such that there's a touchless entry to the office in terms of logging into the office and getting access to the front door, so no more will you have to actually touch a device with your finger. We've had the office professionally disinfected by a company. We've had another company come in and professionally clean all our air conditioning system, change the filters. We're trying to make it as safe a workplace as possible. You'll also see disinfecting stations, and you'll all receive email and a package on your desks. They'll talk a little bit about how you can make your workday safer. Please consider these things not just for yourself, although your safety and health is important, but for those people that you work with. Consider everyone's health and not just your own. Yeah, I think if we follow these regulations and we adhere to them here at the office, I think what you're going to find is a day at work here at OSI is really going to be safer than a trip to the bank or a trip to the supermarket. So let's all get back, and I think you'll find it a safe and fun place to be. As to the virus, though, let me be honest. We are not out of the weeds. There's still quite a ways to go in terms of where we are with the coronavirus or COVID-19. The good news is we've got the best and brightest minds around the world working on a vaccine. It's in many places, there are actual human trials going on. Everybody expects that there's going to be a vaccine available around the end of the year, certainly by 2021. However, we're in September, and we've got to get from here to there. So the bad news is we need to be careful, and we need to take care about how we interact with others and ourselves. Everyone's health is important. But let me talk to you about some health statistics that you may not have considered and why it's so important that we come back to work. The health of our community is something you may not consider, but your health is the health of the community. What I've been seeing in the newspaper over the past several months is here in El Salvador, AFP, as you all know, is a record of all of the corporately employed people here in El Salvador. There's nearly 100,000 people that don't have jobs that did have jobs in January of this year. The poverty level in El Salvador has grown by some 40% as we've had to shut down the economy here in El Salvador, like many countries, to keep a safe working environment. It's been a real struggle for people. Some people really don't know where their next meal is coming from. And that's the health of our community, but we're all part of that community. The good news is we've been blessed. We've had the opportunity to work and earn a living and be safe at home while many other people have suffered. But as we come to the end of the final chapters of this coronavirus, I think it's important that we engage and that you see yourself as part of the health of our community, not just the health of yourself or the health of your family. Each and every one of us contributes to that. This morning, when I was coming to work, everyone has seen the traffic get a little bit heavier, and those are normal signs of the economy reopening. But I saw two things today that really were not planned because I didn't know I was going to see them today and then talk to you about them. But the first one was I came into a traffic circle by the Mormon temple on the way to Santa Elena, and there were two young ladies that had a generator set up, coffee maker, and they had fresh croissants. And as I rolled by that, I thought, I haven't seen that in months. It's good to see. Those people, I don't know where they've been, or how they've been feeding themselves, but they're out there contributing. They're making some fun things available. And I think tomorrow I'm going to stop by and get a coffee and a croissant just because I admire their tenacity to get in the game and to go out and make a living. And then as I got closer to the office, the next thing I saw that I haven't seen in months is there was a man in the gas station selling lottery tickets. And for everyone that lives here, you know that was a staple. It was just part of our community. Those people have been gone. They've been nowhere to be seen. But now they're out there. This is the health of our community, and this is how we contribute to the health of our community. Take care of yourself. Take care of your family. But also don't forget that you're part of a community, and it's important we take care of those people as well. In order to come to work and be out there, and contribute to those folks by buying a lottery ticket, buying a cup of coffee. Those things create jobs, and those people in turn will need to buy things and create more jobs. I think this is how we get through this as a community. So although personal health is important, I'm going to encourage each and every one of you to understand that community health is important. And we should use our blessing, the blessing of months of employment while others have suffered, to now start to contribute and reopen the economy. I guess at the end of the day, none of us live in a bubble. I'm a proud resident of El Salvador. I know all of you are proud residents. And for one, I'm going to contribute and make sure the health of my community is raised up and looked after, as well as I watch for my own health. I look forward to seeing you here at OSI. Let's get back to work.